I'm just going to start off by introducing myself. My name is Anvika Chandagari, and my mentor was Isabella Spalding. I'm currently presenting from Virginia in America, and you'll hear a little bit more about why I decided to choose this topic as soon as I start the presentation. So I will begin now. In recent years, rates of violent crimes in the US have been observed to have a downwards trend. Nonetheless, there were still over a million violent crimes that were reported in 2023 alone. It is safe to say that violent crime remains a prominent issue in the US, and that is why in this presentation we'll be looking into a commonly believed cause of violent crime, mental disorders. According to a study conducted by the American Psychological Association in 2014, 64% of individuals in jail, 54% of state prisoners, and 45% of federal prisoners reported experiencing some mental health concern, and the numbers were found were twice the prevalence than in the general population. One common type of mental disorder that is often associated with said incarcerated individuals are externalizing mental disorders. Externalizing mental disorders are a group of mental health disorders that are characterized by behaviors that that are directed outward, often violating social norms. Some usual behaviors include aggression, rule breaking, impulsivity, and violent problematic behavior. Two common types of externalizing disorders are antisocial personality disorder and its precursor conduct disorder. Both are characterized by a recurring pattern of behavior that disregards basic human rights or major societal norms. The behaviors mentioned are very similar to those of people convicted of violent crimes, and while some studies have observed a correlation between such disorders and crime, there is still much that is unknown about the topic, such as the role stigma may play in the perceived correlation. This brings me to my research question. Is there truly a significant link between violent behavior and externalizing disorders, and to what extent is this commonly believed association due to the stigma linking mental illnesses and crime? Many studies in this field of research simply analyze specific prison populations for externalizing disorders. Instead, I want to understand my question and its nuances from the perspective of professionals that interact with this population on a daily basis. That is why, in order to answer my question, I decided to conduct a qualitative study. In my study, I interviewed three people from the US in different professions that are known to interact with the population I wanted to learn about. I interviewed a criminal lawyer, a clinical psychologist, and a senior special agent. All participants had many years of experience dealing with the population being studied. The questions I asked in the interview could be grouped into three main categories: the common behaviors and disorders found in convicted felons, the interviewee's views on any correlation between mental disorders and violent crime, and other personalized questions specific to the profession. For example, for the criminal lawyer, I asked questions about the legal implications of having a mental disorder, as you can see in the light purple box here. For the clinical psychologist, I asked multiple questions regarding treatments and their effect on behaviors. And for the senior special agent, I included questions that were specific to investigations in order to better understand how a general perpetrator of violent crime might behave. Each interview ranged from 20 to 40 minutes. I observed three main themes that arose. One, information regarding the associations between mental illness and crime. Two, the effects of treatments of mental disorders and its associations to criminal behavior. And three, the perception that the stigma surrounding mental health and how that might affect views linking it to criminal activity. I analyzed and compared the answers in each section with current literature in the field, and that brought me to my findings. So let's talk about my findings. So, regarding the first link, for the first theme about the link between disorder and crime, when I spoke to the criminal lawyer about the frequency of mental disorders within her clients, she stated that 50 to 60% of all of her clients had some sort of mental disorder. Specifically, 30% had an initially undiagnosed mental disorder, while about 20% had a diagnosed mental disorder. This aligns with the statistics of the study that I talked about at the beginning of this presentation, indicating that there is some sort of link between mental disorders, specifically externalizing disorders, and crime. All interviewees, when asked about which disorders they most commonly saw in incarcerated people, stated schizophrenia, which has some externalizing behavioral symptoms, as well as substance use disorders, which is an externalizing disorder. Two out of three interviewees mentioned bipolar disorder, which also has some externalizing disorder symptoms. And finally, the clinical psychologist also mentioned personality disorders, specifically ASPD. When asked about common behaviors of mentally ill individuals that have also committed a violent crime, the criminal lawyer mentioned that she often isolation, and false realities. She also observed that such individuals usually displayed a lack of direct eye contact and a lack of attention, which is characteristic of certain externalizing disorders such as ADHD. The senior special agent added that he often noticed a combination of the mentioned behaviors and some other externalizing behaviors. One example is aggression and a history of exposure to violence. And finally, the clinical psychologist also added that individuals with mental disorders that have committed a crime usually lack emotional intelligence or coping skills, which is more common in undiagnosed mentally ill individuals than diagnosed ones. Which actually brings us to the second theme regarding treatment. The clinical psychologist stated that treatment plays a huge role in helping individuals stop themselves from committing negative actions that they don't necessarily want to do. The criminal lawyer corroborates this by stating that 9 times out of 10, when people in custody are sober and receiving treatment, they become a completely different person from when they were on drugs. This indicates that receiving treatment for a diagnosed mental illness can play a huge role in an individual's chance of committing a crime. The clinical psychologist stated that there are two main types of treatment an individual can go through, both of which are effective and target different issues. The first form of treatment is medication, which targets the biological aspect of mental disorders. It does this by chemically modifying biological systems, enhancing cognitive clarity. A study on 80K participants over the course of 4 years found that being on antipsychotic drugs and mood stabilizers were associated with reduced rates of violent crimes in participants. The second form of treatment is cognitive behavioral therapy, CBT, and this targets the psychological aspect of mental disorders. CBT is basically a psychotherapy to help people understand the effects of their thinking and how to cope with the symptoms. And it has been shown to decrease not only criminal activity amongst the mentally ill, but also recidivism, the tendency of a convicted criminal to reoffend. It is important to note that these treatments don't necessarily remove the mental disorders altogether, but rather just decrease the amount you have to suffer with the symptoms, making them more manageable. Now let's talk about the final theme, social stigma. Four main points arose in this theme. First, 2 out of 3 interviewees stated that individuals with mental illnesses were more likely to be victims of violent crime rather than perpetrators, as they are often seen as easy to take advantage of. Other literature in the field does corroborate this point. However, this is mainly for people with severe mental illnesses like schizophrenia or autism, and not necessarily externalizing mental disorders. Next, because of the cultural stigma surrounding mental illnesses, many people refuse to get diagnosed and treated. The criminal lawyer mentioned that mental illnesses are like the disease of the brain, just as cancer is a disease of the body. In order to resolve any issues or negative behaviors caused by mental disorders, people need treatment, just like they would to get rid of cancer. But because of the refusal to get diagnosed, many people remain untreated, causing the negative behaviors or thoughts to remain, making them all the more likely to commit crimes. This indicates that social stigma, both directly and indirectly, feeds into the link between mental illnesses and violent crimes. Additionally, the clinical psychologist stated that oftentimes incarcerated individuals with mental illnesses not only have a psychotic disorder, but they also, like schizophrenia, but they also have a personality disorder. The co occurrence of these disorders causes behavioral symptoms of the two disorders to mesh together. Hence, people believe that all mental disorders are the same, feeding into mental health stigma. Finally, both the criminal lawyer and the senior special agent stated that many professions that interact with incarcerated individuals on a daily basis don't really have much education on psychology and mental health. And because of this, they are often unable to determine whether or not someone that committed a crime or is being arrested is going through a psychotic break, causing people with mental illnesses to be villainized. This study provides the baseline research for understanding just how much stigma on mental health affects violent criminal behavior, specifically through a lack of access to treatment. Hence, future research should look into specific programs that could be created and issued for people that need to access treatment, making sure to target individuals that are in stigmatized areas of the world. Future researchers should study how effective such programs are. This study shows us that while there is a link between externalizing disorders and violent crime, it is not as straightforward as we may believe, and we need to continue researching this topic in order to better understand how we can decrease the rates of violent crime in America. Thank you.
Thank you, Anvika, for your presentation. I'm curious, based on your research, I noticed one of your slides said that you uncovered that treated patients with psychological disorders are less likely to be violent than people with the same psychological disorder, but that are undiagnosed.
Yeah.
So I'm curious if this makes you have any thoughts about what we might do to increase the diagnosis rate.
So I think that actually leads back to the third theme that I brought up regarding stigma, because a large reason about why people aren't receiving like the treatments that they need is because they are so afraid of being diagnosed with a mental health issue because it's seen as a weakness rather than just like an illness like the criminal lawyer brought up like cancer is. And so I think like I brought this up during my future directions point, but I think when we're coming up with solutions to help solve this, we need to try and figure out a way to combine like treatment centers that both destigmatize the issue of mental health while also offering those treatments for individuals. Because oftentimes, like people that have already been diagnosed with mental health are still like so ashamed of talking about it or bringing it up. So I think like a lot of it really just stems from that stigmatization of mental health.
Absolutely. And as you researched these disorders, I'm curious, were there any themes about when these disorders kind of pop up? And does that spark anything for you in terms of when the right moment might be to screen, for example, to meet people earlier?
Yeah, so the main study, like the main focus of my study was externalizing disorders, and externalizing disorders are generally like personality disorders, so ASPD, conduct disorder, ADHD, and these, for what I studied, these typically kind of arise towards your childhood, your adolescence. Like for example, conduct disorder, it starts off in your childhood, I think around 5 to 10. And then because that's the precursor to antisocial personality disorder, that antisocial personality disorder arises towards your teenage years after you've already been diagnosed with conduct disorder. So I honestly think if we're talking specifically about externalizing disorders, like people should be watching out for signs of mental illnesses or mental disorders from the get-go because it's never safe to assume that everyone's okay because chances are like people aren't because it's just like people believe that everyone's doing okay because of like the stigma. So I think we should be screening for that really early on. It's a little different for other types of disorders like schizophrenia, which kind of arises at different times, but for the focus of this, I think it should happen from the beginning.
Fascinating work. Thank you again for sharing it with us.